Another day, another story. Welcome to Vital Health, where we talk about health and wellness. Today's topic is anemia, a condition affecting millions worldwide. In this video, we'll discuss anemia, its causes, symptoms, and treatment options. So, let's get started. Anemia is a medical condition in which the body lacks sufficient red blood cells, RBCs, or hemoglobin, HGB. Red blood cells contain hemoglobin, a protein that carries oxygen throughout the body. When the body doesn't have enough hemoglobin or red blood cells, it can't get enough oxygen, leading to fatigue, weakness, and other symptoms. Before we continue, please show us some love by liking us and subscribing to our channel VITALSHEALTH. You will stay updated on the latest health news and tips and be the first to know about our new videos. So don't wait, click the subscribe button now. And join the VITALSHEALTH community. Blessing. What is hemoglobin? Hemoglobin is an essential protein found in red blood cells that helps carry oxygen from the lungs to other body parts. It is responsible for the red color of blood and is crucial for maintaining healthy tissues and organs. Hemoglobin also helps transport carbon dioxide from the tissues back to the lungs to be exhaled. Without hemoglobin, the body would not receive enough oxygen to function properly, leading to symptoms such as fatigue, weakness, and shortness of breath. What is the average level of hemoglobin? The average level of hemoglobin can vary slightly depending on age, sex, and other factors, but in general, the normal range for hemoglobin is: for adult men, 13.5 to 17.5 grams per deciliter, gram per deciliter. For adult women, 12.0 to 15.5 grams per deciliter. For children, 11.0 to 16.0 grams per deciliter. For pregnant women, 11.0 to 12.0 grams per deciliter. It's important to note that these are just general ranges, and the specific range for each person may vary depending on their individual health and medical history. If someone's hemoglobin levels fall below the normal range, it may indicate anemia or another underlying health condition that should be evaluated by a healthcare provider. Types of anemia. There are several types of anemia, each with its own cause. The most common type of anemia worldwide is iron deficiency anemia, which is caused by a lack of iron in the body needed to produce hemoglobin. Hemoglobin is an essential protein that carries oxygen to different parts of the body. Another type of anemia is vitamin B12 deficiency anemia. This type of anemia is caused by a deficiency in vitamin B12, which is necessary for the production of red blood cells. Folate deficiency anemia is also caused by a lack of folate, which is also necessary to produce red blood cells. Aplastic anemia is a rare type of anemia that occurs when the bone marrow fails to produce enough red blood cells. Hemolytic anemia is caused by the destruction of red blood cells at a faster rate than they can be produced. Sickle cell anemia and thalassemia are inherited blood disorders that affect the production of hemoglobin. Pernicious anemia is another type of anemia caused by a lack of intrinsic factor, a protein that helps the body absorb vitamin B12. How is anemia diagnosed? Anemia can be diagnosed through a combination of medical history, physical examination, and blood tests. During the medical history, a healthcare provider will ask about symptoms such as fatigue, weakness, dizziness, and shortness of breath, as well as any family history of anemia or other blood disorders. During the physical examination, the healthcare provider will check for signs of anemia such as pale skin, rapid heart rate, and low blood pressure. They may also check for other symptoms such as an enlarged spleen or liver. Blood tests are the most common way to diagnose anemia. A complete blood count, CBC, measures the number and size of red blood cells and the amount of hemoglobin in the blood. If the CBC shows low levels of red blood cells or hemoglobin, additional tests may be done to determine the underlying cause of the anemia. These may include tests for iron, vitamin B12, and folate levels, as well as genetic tests for inherited blood disorders such as sickle cell anemia and thalassemia. Different ways to treat anemia are: the treatment of anemia depends on the underlying cause and severity of the condition. Some common ways to treat anemia include 1. Iron supplements. If the anemia is caused by iron deficiency, iron supplements may be prescribed to help the body produce more red blood cells. These supplements can be taken orally or given through an injection. 2. Vitamin supplements. If the anemia is caused by a deficiency in vitamin B12 or folate, supplements of these vitamins may be recommended to help the body produce more red blood cells. 3. Blood transfusions. In severe cases of anemia, blood transfusions may be necessary to replace the lost red blood cells. 4. Medications. If the anemia is caused by an underlying medical condition, such as kidney disease or cancer, medications may be prescribed to treat the underlying condition and improve anemia. 5. Dietary changes. Eating a diet rich in iron, vitamin B12, and folate can help prevent anemia. Foods such as red meat, leafy green vegetables, and fortified cereals can help boost iron and vitamin levels in the body. 6. Treating underlying medical conditions. If anemia is caused by an underlying medical condition, such as ulcerative colitis or a bleeding disorder, treating the underlying condition can often improve anemia. It's important to note that the best course of treatment for anemia should be determined by a healthcare provider, who can evaluate the individual's medical history and symptoms to create an appropriate treatment plan. How can you increase hemoglobin levels naturally? There are several ways to naturally increase hemoglobin levels in the body. 1. Eating a balanced and nutritious diet. A diet rich in iron, vitamin B12, and folate can help increase hemoglobin levels. Foods such as red meat, seafood, beans, leafy green vegetables, and fortified cereals are all good sources of these nutrients. 2. Including vitamin C in the diet. Vitamin C helps the body absorb iron from food, so eating foods rich in vitamin C, such as citrus fruits, strawberries, and bell peppers, can help increase iron absorption and improve hemoglobin levels. 3. Drinking plenty of fluids. Staying hydrated is important for maintaining healthy blood volume and preventing anemia. Drinking plenty of water and other fluids can help increase blood volume and improve hemoglobin levels. 4. Getting regular exercise. Regular physical activity can help increase red blood cell production and improve circulation, which can help improve hemoglobin levels. 5. Getting enough sleep. Getting adequate rest and sleep is important for overall health, including maintaining healthy blood levels. It's important to note that while these natural methods can help improve hemoglobin levels, they may not be enough to treat severe cases of anemia. If someone is experiencing symptoms of anemia or has been diagnosed with the condition, it's important to seek medical advice and follow the recommended treatment plan. Disclaimer: the information provided in this YouTube channel is intended for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen on this YouTube channel. If you think you may have a medical emergency, call your doctor or emergency services immediately. The views expressed on this channel are solely those of the author and do not necessarily represent the views of any other entity or organization. Thanks for watching.